My lecture title, Addiction is Motivated Volitional Behavior. And that is my soundbite definition of addiction. Addiction consists of behaviors of all different kinds. Thoughts, feeling states, perceptions, interneuronal interactions, the chemicals going back and forth across synapses. Overt motoric actions, the actual picking up of a drink. Semi-conscious activities. Many addicts recognize, particularly when they're in sort of a hardcore phase of addiction, that a lot of what they do seems like they're in a trance when they do it. And so what you see here is reduced self-awareness, reduced awareness, and even as behaviors happening, and we have to consider that motivated. So the trance or trance-like actions and states, etc. I'm covering a lot of territory here under the rubric of behavior. It's motivated behavior and it's volitional. What I mean by that is that it comes from the will. It is willed. There is intentionality. There is intention. Are all motivated. They wouldn't happen if they weren't motivated. This includes cravings. Well, come on, Doc, how's a craving motivated? Well, think about your nervous system letting you know that you're hungry so that you eat. The living system has this mechanism by which the activity of the hypothalamus is putting out signals that says, stomach distension, cell depletion, it's time to eat. This is an activity. This is actually a behavior in my enlarged definition of behavior. It includes cravings, it includes compulsions. Look, I did it. I didn't feel like it was me. I kind of had to do it. Well, that's really related to craving too, isn't it? The feeling of the need to behave is so strong, I caved in. Well, your living system is creating that strong need, that sense of need. I consider that a behavior. It's an activity of the system. It includes the emotional dependency. Well, if I don't do it, I'm going to feel, so depressed. Okay, well then, the effort to avoid depression is the intention of the organism at that point in time. It includes moral decay. Well, I wouldn't be able to do it if I didn't lie, so I don't really want to lie. Well, okay, you have mixed feelings about it, you have some ambivalence about your lying, but the lying is motivated so that you can engage in the behavior without being caught. And everything else that the person does, that the living system engages in or expresses, and all the responding and the responses to responding, and so on. This is all, in my view, motivated volitional behavior. The fact that our normal understanding of behavior doesn't lend itself to this perception doesn't change the fact that I'm defining it this way and I'm doing it for a certain reason or a set of reasons. I'm motivated. I'm motivated to do it this way. So in a nutshell, the question of the what, the why, and the where, and the when of addiction are all potentially answerable as a matter of our having an understanding of any and all motives, of all aspects of a person's intentionality. Now I sit with a bunch of people trying to recover, and I say, why do you use? And you get, a super wide range of responses, including a lot of people that say, I have no clue. Well, the fact that they have no clue about what motivates them doesn't mean it's not motivated. It just means they don't know. They have no clue. And largely what you get are, theories. They're personal theories. Well, I think I'm depressed, and I think I use in order to feel less depressed, or at least I used to. And anymore that I'm, so stuck inside this this monstrosity we're calling my addiction. I don't know anymore because I feel more depressed. I don't feel less depressed, so it doesn't seem to answer the question anymore. But I used to. I know I did use initially because I felt depressed, or I used it to handle my anxiety. And in fact, if you sit with a group of addicts and you say, raise your hand if you think you're using in order to help relieve depression, to help get some control over your depression, a lot of people will raise their hands, and then you say, well, how many of you think you're using in order to cope with your anxiety? And then the rest of the room raises their hand, and some of the people that are depressed raise their hand. Then you say, well, how many of you do it for both? And then a number of people raise their hand, and there's hardly anybody in the room that hasn't raised their hand at that point. Well, what does that mean? Well, they have depression and anxiety, and they're kind of aware of it, so why do you do this in order to handle your anxiety or depression? And then they're sort of clueless. I mean, the doctor gave me some pills for depression, they didn't seem to work as well. Or I took it, I was, experimenting, and I kind of realized, after getting addicted that I had been depressed, because I didn't tell myself that I wasn't really aware of it, but now as you bring it up, it kind of helps me to understand myself. So I didn't initially say, well, I'm going to use in order to medicate my depression. The truth is, a number of people will be aware that they're using to handle their anxiety. And in fact, if you think about it, a large percentage of people that begin their career as an addict in their adolescence do realize that their use began to manage their social anxiety. So the teenager and the desire to sort of fit in and be comfortable inside their skin in social situations. A large number of people that end up addicted do recognize that that was the genesis, that was the beginning of their addiction process. The fact that we may not be consciously aware does not change what I refer to as the operational fact. Operational fact, things work the way they work whether we can explain them or not. Unless we're assuming the devil made me do it, there's intentionality by the living system, or it would not be doing what it's doing. If you're going to say that something outside of you made you behave, and so it really relieves you of any sense of responsibility for the actions you take. You should stop the tape and go on and listen to some other conversation. But if you believe in personal responsibility and the idea that there is no intervention from the outside, whether it be demonic or divine, then operationally speaking, the living system, with or without awareness of what it's up to, is responsible for the behaviors, and those behaviors are motivated. Certainly addicts struggle to become aware of their motives. They're not walking around, just like I was saying with the anxiety and depression, they're not walking around fully clued in to, certainly not to the entirety of their mindset or their, all the aspects of their intention or their motives. That lack of awareness can apply to almost any given action that we take. So this is not unusual for human beings to come up a little short when it comes to a complete understanding of what motivates them. I'll give you a little example